everyone, and welcome to another episode of Fridays with Fawn. My name is Fawn Lopez. I'm the publisher of Modern Healthcare and Vice President of Crane Communications. We're back for another episode, and today it is my pleasure to welcome a friend, Dr. Christy Lemak. Christy is the professor and chair of the Department of Health Services Administration at the University of Alabama at Birmingham. Christy teaches and conducts research in the areas of healthcare management and leadership development, with an emphasis on how leadership and organizational factors are associated with high performance. Christy, thank you so much for joining me today.
It's my pleasure, Fawn. Good to see you.
Thank you. So, Christy, you have built a career in academia, and you're currently the professor and chair of the Health Services Administration at UAB, which, for those who may not know, is home to the nation's #1 ranked graduate health administration program, as well as many other highly regarded programs. I'm sure you've seen a lot of advancement in the field of healthcare management and leadership development during your tenure. Talk to me a little about the changes that you've seen and their impact.
Well, that is a really great question. I think back to the days when I was a health administration program. I went to the University of Missouri, and it was in the late 80s. And there was one option. It was to be a hospital executive. You know, you were going to go work in a hospital or a health system. And we focused heavily on hospital operations and finance. I remember the word quality was a brand new word. I tell the students that, and we now think so much more broadly than having our students work in hospitals and health systems. And we're developing leaders to work across a broad spectrum of the industry. And it's, we don't even want to say non-traditional. We say across the spectrum of health and public health and really talk about a sector that we work in. It's so important in the economy. And we're no longer just saying, let's develop operational experts. We're thinking about leaders who focus on patients and who focus on communities and making a difference in those communities that they serve, and, focusing on inclusive excellence and trying to understand those populations and those communities and making a difference in people's lives. And that's really exciting to me. And that's very much why I work in this industry, is to really focus on the impact that those organizations can make in those communities.
Well, you're working with the future leaders of healthcare, right? Mm-hmm. And you're shaping them. And what a wonderful role and what a impactful role that you play. And so you have always been a big advocate of diversity, equity, and inclusion. Thank you for that. And so I'd love for you, if you would tell us a little bit about how in your role and through your research, you can advance these efforts.
Well, it's certainly so important to me. I mean, it is a passion for me. It is who I am and what I've been about for a very long time. And we really focus on it here at UAB and really across the country with other programs from a couple of different spots, right? I mean, one important thing that we're doing is we're trying to be very intentional about who ends up in our programs. Because if we were not intentional, it would never change. In fact, it's been pretty slow to change. We're working on a paper right now where we're looking at who have been enrolled, the students enrolled in CAMI accredited programs, how that's changed. And it is changing, but it's changing pretty slowly in terms of underrepresented populations and women, right? So how does that change? We're also being intentional about what happens to those students when they go out into organizations and how we can work on mentoring and sponsoring careers. And, what we're finding is, they get a lot of attention right when they come out in administrative fellowships and residencies. But then there's this thing that happens early in the career, sort of early to mid-career, that they really need some attention. And here at UAB, we have some very focused mentoring programs for women, for people of color, to really say, how do we make sure your career goes in the direction and the trajectory you want to be on? But there's a third prong. There's many prongs, but there's another prong, which is how do we help organizations become more inclusive, right? And because there's a lot of organizations in this country who aren't really ready for the students that we're preparing, right? I mean, we can't do it all. We can't just focus here. We have a role to change the world, right? To change healthcare organizations. And we do that through continuing education programs that we offer to our alums and to others. We do that by serving in leadership roles. And then there's this final piece that I'm really committed to as a department chair, and in roles I've played, in national things, is looking at faculty, right? Faculty in health administration programs. There've been some fundamental shifts in my career on what it takes to be a faculty member in our field, and that's where we still have a long way to go, and we really need to think about how we diversify and support women and people from underrepresented groups to be faculty. And that's something that I've been working on really hard here at UAB and with colleagues around the country. So
it's so important what you're doing. And I'm curious, in your work with organizations, are you seeing a more receptivity or willingness now than a year ago or 2 years ago?
100%. Yes. In fact, our students, first of all, our alumni, UAB's got about 4,000 alums across the world. And from our graduate programs, it's about 2,200 alums around the country, but they have been incredibly responsive over the course of the summer with everything and the turmoil that we saw in the United States around this topic. But so many of them were already engaged in equity and inclusion work, right? But I will say that we have had incredibly engaged alums and seen other organizations say, this is something we can't slow down on. We are picking up our speed on not only diversifying, but working on inclusiveness and belonging in our organizations. And how can we do that? And I have to say, what's pretty cool, I just have to share this, is our students are helping us, right? Like when the events, when the terrible events of the spring and when we were sort of, in the state, I mean, I was going to say that, with the pandemic and with the events of, the killings of George Floyd and Breonna Taylor and, the other numerous others. And then with a lot of trauma, frankly, and up about the election and everything that's been going on. We have learned so much from the young people. I mean, it's a really opportunity to be in academia, to have this generation of folks who are really enthusiastic and motivated. And, they came to us and they said, you know what? Our master's students said, we want to create a diversity, equity, and inclusion council among the students.
Wow, that's great.
We want to meet sometimes just us. And then we want to meet with alums, and they've had panels, and they've been, helping us bring all of us together along the way. And I will tell you, our students are getting incredible placement opportunities, and organizations are asking questions in the interviews. Like, tell us about your philosophy around diversity, equity, and inclusion. Tell us what you think about when you hear those words. And I love to see that. And I think our students are gravitating to organizations who are taking this seriously, who are saying they want to work in places like that. So I think that gives me a lot of hope.
That's how organizations are going to be able to not only retain talent, but also attract talent, right?
Yes.
So encouraging to hear that. Thank you for sharing. And, the level of engagement from young people is just so fabulous and encouraging. So as someone who conducts research in the areas of management and leadership, what advice can you share with leaders who are looking for ways to ensure high performance from their teams during such unprecedented trying times? Well,
it's been such a time, right? I mean, it's a time that's been really, there are so many words. I've decided, by the way, I'm not answering your question yet, but I've decided there are words that we're going to remember from 2020. potentially as triggering, like unprecedented, right? There are these words that we use.
I can't believe I used it.
I know. Well, no, I mean, I'm about ready to say it too, right? And there, I think that what I would say, based upon what I know and what I've seen, and we're starting to see some of it in the research, is that resilience. And there's some great work that came out from some colleagues of mine. I did not do this work, but from the management literature, that resilience is not something that you have. It's something that you do. Mm. And I think that leaders who know that practice that, and they do things like, schedule those check-ins and have opportunities to regroup and get new information as it becomes available. And you look at some of that happening not only at the bedside in those COVID units, but at the organizational level, and that there's that opportunity. You don't just say you either have resilience or you don't have resilience. I mean, I think we kind of thought about resilience and grit as sort of something that you had or not had. And it's not what it is. It is something that you do, and that it's the leader job to provide opportunity to enact resilience and to give people, and to really enforce vacations. I mean, to mandate time away, to mandate breaks, because people cannot function at their best when they're exhausted. And when managers, I can't leave, they can't do it without me. Well, you're not functioning at your best when you the tank has run down, right? And so I think some of it is leadership 101, but you forget leadership 101 when it's coming up on whatever we're in now, week, whatever. It depends on when you start counting, but it's it's going to be going for a long time.
Oh yeah, most definitely.
And so, that's what I would say, is that it's at every level, at the senior level of leadership, all the way, some of those things we've seen in those really amazing COVID units, it also goes at the higher level, right, to lead level. Yeah.
So you talked about resilience, and that's one of those, an important trait that we have to leverage, or to act on all.
And to nurture and to build and to rebuild, and yes.
So certainly we live in very unique, challenging times. And besides resilience, what are some of the skills that healthcare leaders should be thinking about developing? What kind of leadership competencies, training, and development must be acquired in order to succeed as a healthcare leader today and in the future?
Well, I think, we had a period of time in the field where we talked a lot about empathy. Yeah. And I think that is once again, I would underscore that. I think that idea of being able to truly be vulnerable and understand the various perspectives. I want to say something, a soapbox that I have been on. I mean, I'm someone, I have 2 children, and they're out of the house, and yet I have many people on my team that have little children, and they've had to work with those children in their home. And, I think the world turned upside down for many, many people. And I think that leaders who've been able to be empathetic for how the world changed, whether that was your experience today or not, right? And I think we saw in academia organizations that could be empathetic and organizations that were not. And I think you're going to lose people. You're going to lose individuals who say, I can't do this. They're going to leave the field. I think we're going to lose nurses. We're going to lose, physical therapists and, respiratory therapists. But so empathy at every level. And, we talk about giving people grace and but I do think it starts with empathy, right? I think adaptability. We had one of our alums tell us that the thing is knowing the difference between rubber balls and glass balls. And, there's going to be some balls that get dropped, and it's going to be okay.
Yeah.
And, I think that remembering what is central and core about what we're doing, and some things we won't be doing.
Yeah.
And I think leadership is, I mean, years ago, I don't know if anyone remembers this, but there used to be that inbox experiment that we used to do, or for interviewing, what do you do with your inbox and how do you prioritize?
Yeah.
It's kind of the same thing, but options have changed.
Right.
And it's always prioritizing people and prioritizing the patient and, knowing what comes first. And some of that you only learn through trial, right? You only learn. And that's why I actually, even though it's been so hard, I've tried to convey to our students and to the people who are fellows and to some of these early careerists that I believe this is going to be really a positive leadership journey for them. It might be their crucible, right? It might be their, I know it's hard to say that, and you would never want it to happen. Right? But find the learning, find the message in what we're going through. And I think that reflection, that ability to be vulnerable and to say, I blew this one, right?
Yeah.
I blew it. What can I learn from it? Is an important leadership. Yeah.
Very important trait, right? So you talked a little bit about, prioritizing and, but also about agility. I think flexibility, agility.
That's right.
Right. Because we will make mistakes.
Absolutely.
Like these, you just have to do what you can.
There's not a playbook.
Right?
There's not going to be a playbook. We're not going to, there's a couple of people writing some great stuff, and I think we're going to rely on that. And that's good. And, we're also going to see all these new things develop. I have to say, looking back, it's coming up on, we had our preceptors conference virtually. We're going to have our case competition virtually that you've been a judge for us. We're going to have, we're doing things we never dreamed we could do. And you know what? It's not what we thought it was going to be, but it's turned out okay.
Yeah. Right? How important is, in your opinion, emotional intelligence is?
Very important. Very important.
For leaders of tomorrow.
I think it's very important. we absolutely, that's part of our curriculum. It's part of our standard educational process is assessing that and helping students understand what their EQ is. And we also do, we do a series of assessments with our students because I think we believe, again, it kind of goes back to in the olden days, it was all this sort of analysis, right? There's a famous, I forgot who wrote the book, but he said, I think it was MBAs are, or organizations are overmanaged and underled. Mm-hmm. And so, the manager kind of knows how to do all those analyses, but leadership really requires you to know yourself. Mm-hmm. And so I think fundamental to leadership is understanding you. Yeah. And that's the class I'm teaching right now in our executive program. And so we do a series of reflections and the students get a little uncomfortable with that, shining that light on themselves. And part of that is emotional intelligence. And I would say the most important part of emotional intelligence is getting an accurate sense of how others view you. Mm-hmm. In addition to viewing others emotionally, reading the room and reading other people, but I think sometimes people they have a blind spot mm-hmm. to how they're perceived by other people. At least career. Right? Yeah, right, exactly. And I think we really think that's been a differentiator for our students and really been, and our alums who've been able to really go and achieve at really high levels. That's part of that. How does leadership get to high performance? Look at leaders, Fawn, you and I both know. Yeah. They are humble and they are vulnerable and they are fantastic leaders. Yeah. So
we've been very lucky. We are lucky.
Yes.
And you're one of those great leaders.
Well, thank you, Fawn.
So I know we're coming up to the end of our talk, our conversation, but I do have a final question for you.
Okay.
As you think about your career and your many accomplishments, and there are many of them, is there anything you really want to accomplish in the next 5 years?
Well, wow, 5 years.
2 years.
I will tell you, Fawn, that you were you've been a huge mentor for me. You have been instrumental in my development, and you gave me an opportunity to go to a session once, and they asked what we were most proud of. And I remember that everyone would have thought I would have said having the #1 program in health administration. But what I was the most proud of was having the most diverse program in health administration. And that is what I am most proud of. I would like to say that we can create more equitable communities. I mean, more equitable healthcare organizations, and that we can really make that change. And I believe we can. And I think that, every year Modern Healthcare publishes that data on the percentage of executive positions held by women and held by people of color. And I would love to see those numbers make some big shifts. And I'm working with some really good people around the country to make that happen. And I just think collectively, I'd love to see those numbers start moving in some great ways. I think they are already. So for me, that's what's really important for me. And so if we can just keep our eye on that, and as John Lewis said, keep getting into good trouble. Yeah, I think I just think there's some energy around that, and I'm seeing our students, all of our students, want to be a part of organizations where they understand communities, and diversity is diversity of thought, right? And it's that energy that comes from better decision making. And so I'm excited about a better health system. That's where I'd like to see us go. Yeah.
Well, I'm with you there, and cannot wait to see that the progress that we will be making as an industry. And I cannot thank you enough for sharing your time and your experience with us, Christy. And thank you for your continued ongoing support of modern healthcare and our effort in advancing diversity, equity, and inclusion. And it has been an honor to know you, and it's been such a pleasure speaking with you today.
Well, right back at you. I have to thank Modern Healthcare. You all have been very supportive of all the efforts we're doing, and we're so grateful for everything you do for students. So thank you for that.
Thank you. Until next month, thank you to everyone watching, and please save the date for Women Leaders in Healthcare 2021. It's going to be on July 22nd and 23rd. Thanks again.